Hello everyone, I'm Roziah from Universiti Kebangsaan, Malaysia. I will talk about a paper on the effects of COVID-19 on the mental health of university students and how music therapy can help. As an introduction, I will start with a statement from United Nations demonstrates that the COVID-19 pandemic is at risk of triggering a global mental health crisis. This takes place due to the thought of the risk of COVID-19 infection on top of having to face movement constraint order or MCO that complicates many aspects of daily life. In fact, students are not...
Sorry, doctor.
Yep.
Sorry, doctor, to interrupt. Would you like to share your screen before?
I don't have any
Oh,
slide.
you don't have.
Yeah.
Okay. Sorry. Continue, please.
It's okay. In fact, students are not exempt from dealing with the effects of COVID-19 also. According to the United Nations in 2020, as of July, 98.6% of students worldwide were affected by the pandemic, from preschool to the higher education levels in around 200 countries. And the most significant aspect is that this pandemic has caused face-to-face teaching and learning methods and assessment to no longer be possible. Instead, they shall be carried out online. This research is descriptive and based on surveys rooted in qualitative and quantitative as the primary methods. For the primary data collection, this research used structured questionnaires, which contains 3 sections, namely the demographic of the respondents, the situation or constraints encountered while taking online classes, and the impact of the situations on their mental and emotional health. The target group for this research is students from higher learning institutions in Malaysia, and the questionnaire is openly distributed to students of all levels of study, including those in foundation, those in diploma level, those in bachelor level, master and doctor of philosophy levels. 79 respondents involved in this research as a whole. Okay, all respondents had participated in online learning during the COVID-19 pandemic, and 2 things that were assessed on respondents are the situations or constraints encountered while taking part in online learning and its impact on their mental and emotional health. As an anticipated outcome, I divided it into 3 parts. The first part is about situations or constraints encountered while taking part in online learning. The second part is about the effect of the situations or constraints on mental and emotional health. And the third part is about respondents' inclination towards the application of music therapy in addressing mental health issues. For the situations or constraints encountered while taking part in online learning, the result shows that the main constraints is poor internet access. I'm sure we are having the same difficulties, followed by bored of being locked at home and the environment is not conducive for them. As for the effect of the situation or constraints on mental and emotional health, almost 70% agree that the constraint affect their mental health. And regarding respondents' inclination towards the application of music therapy in addressing mental health issues, the results showed that respondents are more inclined to utilize music to manage mental health difficulties. As for discussions, I would say that various treatment options such as the use of sedative or music therapy can be used to overcome mental health concern. Research by many scholars found that majority of mentally ill patients who frequently take sedative experience only brief alleviation. In reality, there may be adverse repercussions, and in contrast, music therapy is viewed as a potential complementary and alternative medicine treatment consistent with the current medical approach. It can be used to treat depression by reducing depressive symptoms, heart rate, breathing, and also blood pressure. In addition, there are no adverse consequences for the patient using the music therapy method. According to studies also, patients who listen to gentle music in psychiatric wards have a positive influence on major depressive patients. Such favorable benefits include the recovery of affective or emotional illness, as well as physiological, psychological, and psychomotor conditions. The respondents' inclination to utilize music to address mental health concern is consistent with the role of music therapy in the treatment of mental disease. Positive effects include the recovery of affective, physiological, psychological, and also psychomotor disorder. The respondents' inclination to utilize music to address mental health concern is consistent with the role of music therapy in the treatment of mental disease. Under the area of mind and body therapies, the National Center for Complementary and Alternative Medicine places music therapy in the art therapy group. Body and mind intervention refers to a practice that increase mental ability to impact the functioning of the body and alleviate symptoms. Since the dawn of time, music therapy has also been demonstrated to be an effective way of treating mental health issues. Numerous prior investigations have demonstrated this, and previous studies have demonstrated that music therapy is an effective method for treating mental health issues. This strategy is still applicable and has withstood the test of time, as seen by the respondents' enthusiasm for employing it to treat their mental health issues. Islamic cultural luminaries such as Al-Kindi, Razi, Al-Farabi, Ibn Sina, and Sidi have long felt that music therapy has a favorable effect on the patient's emotional, patient's spiritual, cerebral, and physical skills. And this therapeutic strategy works by entertaining, by soothing, by relieving or easing pain, bolstering the immune system's ability to fight disease, aiding in the healing process, and also diverting the patient's focus away from the pain in order to make them calmer. It produces physiological responses because the rhythm of music has a symbiotic relationship with the heart rate, blood pressure, breathing, and the overall biochemical changes of the body. Stimulate sensory functions such as touch, vision, taste, smell, reduce pain and muscle tension, and is effective as a natural analgesic by secreting endorphin hormones. With that note, I will end my presentation. Thank you very much for